Tackling how to pay for healthcare when you're retired really varies based on when you retire. If you retire before you're 65 years old, you'll have to either rely on potentially COBRA, which would be a continuation of coverage from your employer's coverage that can last for 18 months. If that has lapsed, then you can rely on individual health insurance, which has become a little bit easier with the Affordable Care Act. There's a website that you can go to compare costs and different plan options. And that will allow you coverage until you're 65. And when you turn 65, you have access, of course, to Medicare. And along with Medicare, you should consider purchasing a supplemental Medicare insurance policy. There's also a third coverage that you're probably going to need, and that's called Medicare Part D, which covers your prescription drugs. And so that's a long process, and there's several different policies you have to consider. Another thing to couple with that is to consider if you are still working and have earned income, funding an HSA account, which is a health savings account. That can help for healthcare costs both before you retire, but really in retirement, and kind of create a nest egg for healthcare costs in retirement. So in addition to the different insurance policies that you have, it's very important to consider healthcare costs in retirement. A lot of people, when they're working, may have less healthcare costs if they have a good insurance policy through work. And so when they're adding up their expenses in retirement, they might neglect thinking about their health care costs. And another part of that is actually dental. We see a lot of clients coming in that are having dental work done, and that can add $2,000 to $5,000 a year in your budget. So it's important when you're doing retirement planning to build that budget item in as an ongoing annual expense.